Wait, I did not sign up for 4 hours, guys.
Oh, that's too bad. Denice Koo is currently the Director of Patient Education at SeamlessMD, where she leads a team that designs interactive, accessible online programs that guide patients in real time through their surgical self-care journey. She specializes in designing for health literacy, health behavior change, and accessibility. In the past 12 years, Denice has designed over 400 resources and programs for healthcare organizations across North America. She's worked at almost every teaching hospital in the Greater Toronto area, and her programs have been shown to drastically improve patient satisfaction, reduce readmission, length of stay, and unnecessary emergency visits after surgery. Denice holds a Bachelor of Science in Nutrition and Food and a Master's of Health Sciences in Nutrition Communication from Ryerson University. On top of all this, Denice has recently launched a separate business that combines her passions for nutrition, cooking, and animals. The business is called The Good Boy Bakery, and its CEO is Denice's dog, Milo. Denice, welcome to the show.
Thank you, Alan. Thank you for that very elaborate introduction.
Actually, it sounds like we know who our next guest is going to be after Denice. It's going to be Milo, your dog running a business.
It's going to be a very silent podcast.
We could just have a staring contest with Denice's dog.
I'll just pose him in different positions for you.
I'm down. At Seamless, we're very big on diversity, and that extends to all kinds of animals.
His schedule is open. Go for it.
All right.
Well, for today's podcast, Denice, we wanted to talk to you about health literacy because you are not only our resident expert in health literacy, but you're recognized across North America as an expert in health literacy. And so we're really glad that you were able to make it today.
Yeah, no problem. Thanks for inviting me.
Yeah, and just to kick things off, I think, Denice, lots of times in healthcare, particularly I think in digital patient engagement, people don't realize that it's more than just the tech. Right? Mm-hmm. A big component of the engagement being successful is the actual clinical content and the quality of it mm-hmm. and the accessibility of it to patients for the tech to be useful for patients. And so I'm really glad that we have you, and I hope that a lot of our tons and tons of viewers and listeners get an appreciation for that after this time with you.
That's awesome. I'm lucky to be here.
All right.
So maybe to kick things off, Denice, we all know that health literacy is kind of this buzzword in the industry. Mm-hmm. It's widely used for, kind of as an umbrella term covering a ton of different topics. But maybe would you be able to summarize what health literacy is to you and maybe where some of these other concepts like behavior change theory and accessibility and adult learning, how those kind of all come together?
Yeah, I think there are a number of different definitions out there for health literacy, and there are new ones springing up every few years as well. But the way that I like to summarize it is the ability for someone to get, use, understand health information, and to use that to make good decisions for their own healthcare.
Is that a definition that you would have learned in school, or where did you learn about health literacy?
Yeah, so my understanding of health literacy, I guess, started off in 2008 when I got a job actually at the Center for Online Nutrition Communication as a research assistant. And while I was there, I actually got a chance to mentor under some really fantastic people, some of the best of the business. And there I learned how to create patient resources that were patient-centered. I learned about the concept of health literacy. I actually had a chance to design resources along with the rest of the team for Sunnybrook's Odette Cancer Center, which was a really big turning point in my interests and in my career. And I actually learned how to sit with patients and spend a lot of time listening to them, testing out those resources. And I think kind of that was where my career changed, where my interest went from health literacy, from nutrition alone, over to patient education, health literacy.
Denice and I, we chatted before this recording, so we had a bit of a chance to catch up, but I understood that, you did this program initially at the Center for Online Communication as a summer job, and then that transitioned into more of a full-time gig for a little while, and
Mm-hmm.
that was before getting into more of the holistic approach for how you combined all these disciplines together.
That seems to be the common theme in my career. It always starts off a little more casual as a summer job, and and I end up staying 2 to 5 years for everything. But yeah, I started off as a research assistant, and then actually soon got promoted as a project manager. So I actually learned how to manage patient education um, programs through that opportunity over there, and that actually led to a master's degree where I actually took a deep dive and learned a very holistic approach to patient education. While I was doing my master's, I learned about health behavior change theory. I learned about accessibility, online accessibility. I learned about adult learning theory. And all that has really shaped the holistic approach that I really take to design all the resources and programs that I do today.
So Denice, just to clarify for those of us who aren't as intimately familiar with your career path, so
Yeah.
correct me if I'm wrong, but you started off, I think, doing your undergrad in nutrition, and it sounds
Mhm.
like this job opportunity happened in the summer, like in the middle of your undergraduate degree, and then that kind of uh, got you excited even more about communication and patient education, and then that led you to choosing to do your master's. Is that sort of the path that you took?
Yeah, yeah. So when I started at the Center for Online Nutrition Communication, it was 1 year, the summer right before my final year.
Mm.
Yeah, and I think before that point, I was very kind of set on I'm going to go like traditional route for healthcare. But after sitting with the patients and seeing their reaction and how appreciative they were of the work, and how I was able to embed very creative elements into patient education, working with artists and videographers and all that kind of stuff, I realized that this was something that I really loved, and it soon became a lifelong passion for me.
That's awesome.
Yeah.
I also think we'd be doing this conversation a disservice if we didn't talk a little bit about your background in terms of your culture and the different perspective that you brought basically to the industry, and the perspectives on culturally accessible language, and how we use language to communicate different ideas with different cultures, and how as humans we understand language differently. Are you able to shed light on some of that and how that's maybe influenced your trajectory of your career as well?
Yeah, I think growing up in a mixed race family, my family is Chinese Spanish, and we have some folks from Germany a few generations back as well. Um, it has really shaped the way that I look at health literacy, about accessibility, about language barriers, all these kinds of things. I think what the academics has given me is more of an academic vocabulary to express the concepts that I've always inherently understood. I think about, for example, like my grandparents, like my late grandparents back in the day, super intelligent, successful people who spoke English, but their mother tongue was still Cantonese. And so from a young age, watching them navigate the healthcare system, I understood that even though they spoke English, there was still a gap in whether or in our ability to provide them with quality educational resources to help them navigate our healthcare system. And there was still a lot of work to be done to create a more dignified and kind of empowering experience for the average Canadian and North American.
Hmm.
Yeah.
And by an empowering experience, does that come down to the actual instructions that we're giving patients, or what does that mean exactly?
Yeah, I think it means reaching people where they are, making them feel like they have the power to make their own decisions, that you kind of take that and put it back in their hands. It is about the tone of how we write and how we present our information. So the old method or the old model for healthcare is the patriarchal model for healthcare, where it's a top-down approach and the doctor tells you what to do, and you do it, and it's kind of like a one-way type of relationship. Whereas when you're designing great patient education materials, you want to create materials that have a very educational tone and just help people build their intrinsic motivation to do certain things by just explaining to them why it's important, like what problem it solves for them, and providing that in the language that that works well for them. And that in itself is the start of a very empowering experience.
So Denise, I guess before you and I met and you became part of the Seamless team, you were designing all sorts of patient education materials and resources for tons of these top academic hospitals. Um, what sort of like the range of things that you were designing? Like I think I remember it wasn't just paper-based things. There was a wide variety of modalities that you were working on.
Yeah, I think I was very lucky to have been a part of so many fantastic patient education teams across the GTA. And I worked on, with them, I worked on classes. There were, I guess, posters, manuals, small booklets, pamphlets, videos. Those were always my favorite. Bringing in like the standardized patient actors and a video team to come in to do that. That's always a lot of fun. And yeah, I think there were some other things as well, but I think that's like a pretty good summary. It was a pretty good variety of things that we worked on, and it depended on the purpose of what problem we were trying to solve with education. But I think the one big missing piece was there wasn't a lot of digital engagement opportunities out there. And it was a very specialized field that I think that required a very specialized team to execute really well. And at that time, 10, 12 years ago when I first started, that wasn't available yet in the hospitals.
Gotcha. And sorry, Alan, you're gonna say something.
No,
Go ahead.
go for it. I mean, I was just gonna say I'm not as familiar with how you two met each other and how you guys got in contact and at what point. Denise, I know you were working with a bunch of hospitals, and then at some point you transitioned to doing more consulting work. And I think that's kind of the gap in and around there is when you met Josh and SeamlessMD. But I'm not entirely clear on how that meeting happened.
Well, actually, Alan, if it's okay with you, before we get to that, Denise, let's get your take on what sort of motivated you to be an entrepreneur and go out and do your own thing. And you're obviously taking a risk when you're doing that, right? I'm sure you had some good stability with what was going on in the academic hospitals. How did that happen?
Yeah, I think that for me, I've always believed that health literacy is something that should be part of all of healthcare, whether it is in the hospital environment, in the community environment, in family doctors' offices, public health offices, and whatnot. And what had dawned on me as I was working in the hospitals was that it was the wealthy research teaching hospitals that had the patient education teams in there. And these types of services, this type of support was not available to anyone else out in the community. And that's really where 90% of our healthcare is actually received, if you're lucky, is out in the community with your family doctor and whatnot. And so, it really became my mission to be able to support people out in the community, smaller businesses, smaller companies. And it was my dream to make health literacy available to everyone at all the different stages of their lives.
Amazing. And by the way, this is a side note. I don't want to take this off topic, but your comment about kind of making this more accessible to all kinds of organizations, particularly the ones who don't have the resources, aren't as, I guess, wealthy from that point of view. This is actually, not to be provocative, but I actually have the same take personally on things like philanthropy and healthcare. I see so many of the top, like well-funded, like mostly academic hospitals with well-resourced, big brand foundations, and they get all the funding, to be honest. They're able to afford purchasing the next MRI that they need, or any other capital equipment they need. And I see all these smaller, maybe rural hospitals who have a lot more trouble, frankly, raising capital and getting resources, and they can't buy that MRI for their community. really needs it, for example. So I'm actually kind of biased now, where if I'm ever going to be a philanthropist in some way, or even just donate to a hospital, I'm actually going to donate to the one that probably didn't get the funding. So I really appreciate kind of your view on that. Not saying it's wrong to donate to big branded
Yeah.
hospitals. Totally cool people do that, but I definitely think you would make a great point about making things more accessible. Um,
Mm.
to finally get to Alan's question, which I so really interrupted. I actually, I don't know if you remember, Denise, but I actually went back and looked up my own communication with you to figure out, okay, how did this start? So before I share my notes, do you remember how we got connected?
I do remember how we got connected. Um, So this was after I started my consulting business, Health Education Design, and I was really hustling at that time. I tried to book meetings with every major healthcare organization I could, as much leadership as I could. I really was like a one-man company. So I was trying to do the sales along with everything else. At that time, I met up with also a lot of startup folks, people who were working in healthcare. And I guess I must have contacted Josh from LinkedIn or something like that. But I was lucky enough to land a meeting with Josh.
But can I read you our initial communication? I won't read the whole thing.
Yeah, go
But
for it.
but Denise reaches out to me March 31st, 2015 on LinkedIn. You're right. And I'm not going to ask you if this was a templated email. I'm not
Yeah.
going to, it probably was, by the way, but that's okay. And I replied to you on March 31st saying, thanks, Denise. Appreciate your note. We aren't looking for anything right now, but should that change, we'll certainly keep you in mind. Kid you not, less than 24 hours later, I re-messaged Denise and I said, hi, Denise. Actually, there might be something. Will you be in the area next week? I don't know if you remember that. And then,
I
and
do
then
not remember that.
yeah, I don't know what happened, but I
Oh
think
my
probably what
gosh, that's
happened was I probably
hilarious.
went on your website and I said, oh, like this is not some like irrelevant spam kind of thing. This is actually really, really compelling. So I think
So
that's how it
fickle.
started. Yeah. Um, and then,
Denise,
That's
and then
hilarious.
what's that?
can I just ask something? What happened when you had this meeting with Josh?
Oh my gosh, that's
Then
hilarious.
was it basically you just quit consulting right away and started working with Seamless, or how did that transition happen? Because I know you did your consulting for quite some time.
Yeah, I think as is the pattern for most of my jobs in my life, it started off as a much more casual thing. So in the beginning, when I started working with Seamless, so rewind back, I met with Josh and I took him through my little presentation deck about health literacy, about patient education, why it's important, all that kind of stuff. And then there was radio silence for probably a few weeks.
Both of you.
Josh.
By the way, I'm looking back at my old emails. It was more than a
Yeah.
few weeks.
That's what I thought. It was for a while, so I kept busy in other ways. But then Josh actually came back and contacted me and said, "Hey, we're looking for someone who is more dedicated to design programs for Seamless. You helped me really see the value in this kind of role here. Would you be interested in filling this role and doing this for Seamless?" And I said, "Hey, that sounds really cool. Not exactly what I had in mind when I contacted you." But for me, since I started in digital health, an opportunity to work again in digital health really is a dream come true. Like that is actually where I started and where I wanted to be from day one. So I jumped at the opportunity, and the co-founders were really kind in that we made an arrangement where I actually was running my consulting business for a good number of years while I was working with Seamless. And I was just kind of, when Phil needed a program that needed designing, he would just, send me some materials, I'd design it. And it kind of blossomed from there. I think from my perspective, since we started in like such a casual, kind of easygoing way, like my relationship with Seamless has blossomed in a way that I could never have imagined. And to see the company grow to where it has been today has just completely like blown my mind. And over time, what started as a more casual relationship has become 100% of my time, is now at Seamless. The co-founders are like, like friends. They're like brothers to me at this point. And I've built a team here of patient education specialists and QA testers. And so we've kind of over time created our own little patient education universe here at Seamless. So I mean, it is really something that I couldn't imagine it to be, but I'm very lucky. I feel very lucky to have been part of it.
Well, Denice, I think we all feel lucky that you took a chance on us when a lot of people wouldn't. And you've done a fantastic job building out the patient education aspect of SeamlessMD, and I think definitely made our company and our product more patient-centered. And actually, if it's okay with you, I actually did want to share a bit about kind of during the actual recruitment process, some of the highlights for me. So just for context, the reason why, I did end up reaching out to Denice, I think it was like 3 months after we first met. And
Thanks, Josh.
Yeah,
was that a playbook, Josh? Was that a playbook decision?
Yeah. You got like 3 months, But I think at the time, what had happened in the company was, we started working with the big hospitals, and what we were finding was that there was so engagement with patients on the platform. And at the time, I think all we were doing for the most part was just sticking the paper-based instructions from the hospitals onto the platform. And particularly for some of these, I'll call it, I don't say simpler, but lower risk procedures. I think it was gallbladders and hernias and things like that. At the time, at least, all the patients got on the platform were these, it was like 1 page of instructions, and there wasn't a lot of good reasons to engage the platform. There was limited utility to the platform. There was limited, education content on the platform. And so part of the hypothesis, again, like we obviously weren't experts at the time by any means. So part of the hypothesis was like, hey, well, you know what? If we brought in someone like Denice, who had incredible talent and experience on the patient education side, maybe that could help us figure out how can we actually engage a patient digitally. And then when we actually went through the hiring process with Denice, and by the way, for those of people who don't know, we've never hired someone with Denice's talent and background before, so we didn't know how to find the right person for this. I'll tell you. So one thing we actually did, and Denice, you probably remember this, is we actually had this validated. It was the EQ5D patient-reported outcome survey, which is a quality of life health survey. And what we did was, for anyone that we were kind of interviewing, we would give them that sheet, and we just asked them, I think, how would you make this more patient-friendly and easier for a patient to use and understand? And I remember that everyone else that we had interviewed, they would just look at it and they would say things like, oh, this seems pretty good, or I might change this one word here, but otherwise it's good. And or they might change something, and I asked them, well, why would you change that? And there was no real good reason. And I remember just asking Denice, hey, how would you change this? And then she immediately just like took out her pen and was like, oh, like we would change this because like this word like is like wouldn't be accessible, or it's way above the reading level, or all these kinds of things. And she would just like mark up the whole questionnaire. And I sat there being like, wow, like Denice really knows her stuff, because everyone else just gave me some like BS answers that frankly didn't really like seem like it would make a difference. But like Denice was the real deal. And I don't know if you knew that, Denice, but like that blew my mind. I was like, okay, like Denice really knows something special.
I did not know that. I feel like I'm having so many revelations right now.
Oh yeah, that's what happened. And then I think the other thing, again, not just to keep like tooting Denice's horn, but I think as we spend more time with Denice, like actually, now at SeamlessMD, there are all these other things that we learned from Denice that had become part of the platform that I don't think anyone, had planned for, right? So, the platform now, meets accessibility guidelines. So like I think WCAG, like AA certified. So, things like it's been colorblind tested and contrast tested and screen reader accessible. And there's all these little things that most people in healthcare, ourselves included, didn't realize were important, for example, or didn't even know existed.
Mhm.
So maybe Denise, if it's okay with you, can I kind of ask you,
Yeah.
when you went from, let's call it either more traditional paper patient education, or maybe less sophisticated like web-based or video things, to something like Seamless, which
Mhm.
is much more interactive and in some ways much more robust than what healthcare has seen before.
Mhm.
What was your thought process about translating your principles in health literacy, accessibility, and patient education to this brand new format? Like, how do you think about that now?
Yeah, I think the foundation is largely the same. So the concepts of health literacy, the theories I would use in health behavior change, and in like language accessibility and other things, those are all generally the same. Where it's different now in digital health is, for example, like we know that people actually read differently online versus in print. We're actually a lot more patient when we read in print, and we actually go through word for word, whereas I'm sure you would all agree, like when we read online we tend to skim in a different pattern. So now we adapt those kinds of different writing styles. We write in inverted pyramid styles to match and to make it less likely that someone will miss text, which is important, especially in a healthcare situation. And we also do a lot in terms of like online accessibility now. So WCAG, as you mentioned, we do a lot of those. It seems like a few guidelines, but I'm sure the engineering team will tell you that it was hundreds of hours worth of work to make it compatible for people who use screen readers, for example, those who are visually impaired. We actually had a chance to interview 3 people who had some sort of vision impairment, ask them to go through Seamless and tell us about their experience so they can give us some feedback on that. And they actually told us that their phones are their lifelines. They depend on their phones to access all their information, and they depend on that compatibility for screen readers so that they're able to access that information. And so we put in a lot of that work for people like that, or even people who are just a little bit older and they're having, their eyesight is not as good as before. I think you see it a lot where people like holding their phones, trying to adjust to see things clearly. Even for, the average older adult, that's why we put in all that work in there.
So maybe on the topic of interviewing patients, for example, Denise, I think sometimes a lot of providers who get involved in these kinds of initiatives, or creating up a patient engagement application or things like that. I think sometimes clinicians feel as if we're the experts, and if we're creating an experience for knee surgery patients, then the orthopedic surgeons and the physiotherapists and the nurses involved have all the knowledge in the world to create a great experience for a patient. But one of the things that you've brought to Seamless is that whenever we create a new care plan for a different condition or a surgery, it's been really important to you that we actually interview patients who've had that sort of health condition or surgery. In fact, Denise, when we work with a new customer health system, even for conditions or surgeries that we've done before on here at SeamlessMD, you also make it a point that we aim to interview patients at that organization who've had that clinical experience. Why is that important to you? And why do you push for that when, frankly, a lot of other companies or organizations don't take the time?
Yeah. Being in tune with patients, talking with patients, and spending a lot of time listening to patients really is truly the only way to be patient centered. You can't do it by imagination. We're really not that patient group. And so for me, I always insist on taking that time to talk to the people that we're designing for, and understanding, what was most stressful for them, what was the hardest for them to manage, and what did they love about their care, and get those stories before we even start, to make sure that their highest priorities are always taken care of, in conjunction with all the clinical information that we need to include from our health partners. Yeah.
Denise, another term that you mentioned to me was social cognitive theory. Does
Mhm.
that fit in really well with with being patient-centered, or how does that fit with patients that are on a platform or reading materials?
Yeah, so I use social cognitive theory. It's one of the leading health behavior theories that people use in healthcare. And basically, it's a theory that elaborates on learning by observation, which I think we all understand, building self efficacy, and identifying and removing environmental barriers. A lot of research has been done on programs that are designed using social cognitive theory in healthcare. And they see that self efficacy is actually directly related to health outcomes at the end. So if you're able to build the patient's self-efficacy during your program, you also are able to likely move those outcomes. So it has become one of the key measurements and markers throughout the different periods in our programs. I think at Seamless, the beauty of it is that we're so data driven and analytical. We're able to collect that data in real time from all our different patients and make sure that, our self-efficacy rates are high, and we're collecting those barriers in real time. So, yeah.
And you mentioned obviously SeamlessMD being an interactive program where you can put these different measurements or markers in throughout their care journey. How does interactive programs or digital programs like an app, how does it differ from other digital forms like reading information on a website and paper even? How does it different from paper? And then maybe what are some of the different benefits of having an interactive platform that you found?
Designing an interactive platform is so different from designing something in print or anything else. I think the foundation, the health literacy principles, all those accessibility principles are the same. However, I had to learn algorithms. I had to learn, code. I had to learn how to design something that depended on logic, how patient characteristics work. And I had to learn a whole other language so that we can program programs that feel almost magical to patients. So, for example, if you were a smoker and we collected that patient characteristic, then you and only you who is a smoker would get that information about smoking cessation on the platform. So as a patient kind of went through that process, things were coming up in real time. Things that were specific to them would adjust in real time. And for patients, like, that is quite a special experience that you rarely get to do outside of digital health. And so for me, that was actually a really big learning curve. I think on a piece of paper, you just write it down and you say, like, if you're this, if you're that, do this. And, that's the end of it. But for us, it's a lot of quality assurance testing and making sure that every pathway a patient goes through is the right one and feels equally as magical for them.
Could you talk maybe a bit about, one of the things about digital patient engagement like Seamless is that you're able to constantly make like updates to the patient experience much more quickly than I think we normally do in patient education in a typical healthcare organization. Could you maybe compare and contrast like what that looks like with digital versus, a typical organization? Like, are
Mhm.
they? I mean, I'm curious to know, like, is a typical organization actually collecting patient education feedback and then updating it once a year, or how does that normally work, and how does that work here at Seamless, for example?
Yeah, I think it depends on the scope of the project. But in hospitals where they are producing these materials en masse, oftentimes they only go through a plain language editing process and they get approved by the clinical team and they go straight into use. So there's not too much follow-up after that process, just because of the sheer volume of the number of resources. I remember one year in a hospital I did 300 resources, print resources alone. And so you can imagine that times, 10 years, that's a lot of resources to update and test over time. The beauty of digital is that those changes can be done once and sent out to 10,000 patients after you publish it, and it can be done in real time. So you can make that change today, and then 2 seconds later, all your patients have that information. And you don't have, 500 printed pamphlets left that you now have to figure out what to do with. It makes a huge difference. And I think in terms of updating materials, it's easier for the clinical team too, as well, just to do it once and do it quickly.
So what would happen like normally in a healthcare organization, like such as a hospital? So let's say the clinical team decided, oh, actually there's a, I don't know, a new best practice way of doing something. So ideally we would update the patient materials to reflect this new change. Does that, like, do they just not update the materials but then implement the change anyways, or do they just not make the change so that way they don't have to worry about the materials being different? Like what have you seen?
Yeah, so it really depends. So it depends on the clinical team themselves. Sometimes they don't always remember to update the print resources right away. But when they do, then they have to kind of assess at that point, how many copies of paper do I actually have left? And then should I finish using those 200 copies left in the closet, or should we get rid of those and reprint another 200 copies out and give the updated copy to patients? So it is a dilemma either way, especially since these materials tend to be printed en masse to make it easier. So if it's a team that kind of prints on demand and in low volume, the problem is a little less. So it depends on the clinical team.
Yeah, I mean, so it's crazy to me because I mean, healthcare, especially now, changes so quickly,
Mhm.
and it's almost scary to think that your clinical team, who might know that certain, I don't know, steps for a patient are better
Mhm.
for your outcome, that they have to think about the logistics around, can I feasibly tell the patient based on how many pamphlets we still have of the old version versus the, that just seems, I mean, I get it, I get why it happens, it just seems crazy to me that this would happen. I mean, I'm sure you've seen it, Denise, more than I have, but I've seen cases where um, the pamphlets that the patient gets say have a date that's 10 years old, but then if you go on the hospital website for that same health condition, the one on the website is 5 years old, and oh my gosh, it's just I feel proud of the fact that we're able to update these things regularly with our clinical partners, because it's just
Yeah, I think I feel really bad for all the parties involved. Because I think I've seen some nurses who wanted to use some of the old materials, but wanted to make sure their patients had the latest. They would handwrite. I watched nurses like
Mm,
handwrite and hand correct resources, every single one, as they gave them
mm.
out to patients, just to make sure patients had the best information. And that's a lot of time and a lot of love coming from the nurse. So I think digital health definitely makes everything a lot easier.
Mm. Alan, do you have a question or
I do. Um, Denise, I was wondering what makes a good patient education champion, and maybe drawing from experience with SeamlessMD customers, do we have any really standout patient education champions in your mind?
Yeah, I think what makes so the first part of your question, what makes a really good patient education champion, are people who talk about health literacy um, in their clinical group meetings, who bring it up as a priority when they determine priorities for the year, resources for the year. Those who advertise for all the resources being translated for different languages and providing a budget for doing those things and partnering with patient education to do that work wherever they may be. I think that to me is an amazing patient education champion, and I think we have so many of those as customers. I think everyone who is a customer at Seamless greatly values patient education and patient-centered care. So I think I've been really lucky to meet a lot of really fantastic champions. I think like two that come to mind right now, just for an example, are our friends at UAB. I think they deeply care about health literacy, and in their setup survey in our programs, they actually take a bit of time to ask a few questions about a patient's health literacy level and measure that as patients enter the SeamlessMD system and provide that information back to the clinical team so that those patients are able to have that additional support. And I think they published a few papers about this as well. And so they really have gone out of their way to make health literacy a priority in their day-to-day workflow. And so they've been amazing and a great pleasure to work with. And another team that comes to mind are our friends at Baystate. I've had a lot of fun working with the champions at Baystate. They're so collaborative and they're so open to discussing different ways of presenting patient education in a clear and engaging way. You know, like we talk about different possibilities for the future, such as, you know, video chats, like different ways to engage patients, prehab programs, and other different options. And for me to see that kind of energy, to see that kind of innovation coming from the people that we work with, the clinical teams that we work with, is so encouraging and is really a huge part of what keeps me going and hopeful for the future.
So, Denice, as you know better than I do, not every frontline provider immediately gets health literacy
Mhm.
and accessibility and the importance of it. And I'm sure you have times where you get pushback from providers who, maybe don't believe that the reading level has to be lower. Or I think we all know, I won't get into it, but there's certain words that certain providers that we know a patient might have you just have understanding, but the provider might prefer more clinical terminology inside the content. Um, what's your approach to engaging providers on these topics when you feel like they just don't see the value of these principles?
Yeah, I think that's a really fantastic question. I think largely in my career, I've been really lucky to meet a lot of clinicians that really get it. And for those who don't have a lot of background in it, they tend to be very open to learning more about that topic, especially since they're talking to me and I'm in patient education. Um, but generally speaking, you know, the way that I approach patient education, because I'm a big nerd and I come from an academic kind of background, I really very much rely on the research and the evidence to present my case. Um, there has been a lot of research regarding health literacy and its effect on health outcomes, use of preventative care, um, and a number of different factors in healthcare. And I really rely on that kind of research to provide the rationale. There are best practice standards and universal precautions for health literacy created from many of the leading organizations, especially in the US, who have been an amazing champion and research institutes in health literacy. And I rely on, for example, like the American and Canadian plans for health literacy. So we have status reports on how we are doing as countries in health literacy, how it's affecting, how it's costing our healthcare system. So I rely on all these things to kind of speak the same language as the scientists that I'm talking to. I think we're all scientists. We all believe in evidence-based practice. And when I present the information in that way, I find that most people are actually, they get it. And they're open to these types of suggestions. I think in addition to that, at Seamless, we've done a really fantastic job of collecting our own metrics, working with different partners on case studies, on research studies, and our partners have published a number of evaluation studies on their work with Seamless. And those are also really great ways that we can show the effects of the work that we have and the recommendations that we have on the patient population. And that definitely helps kind of support the recommendations that we create.
Awesome.
Yeah.
Denice, also with your background in consulting, were there any like soft skills or any actionable skills that you brought forward to now working with clinicians on SeamlessMD and figuring out how to engage them in a meaningful way that can actually lead to a positive result? Are there any kind of soft skills that you carried forward or that you found to be instrumental in how you conduct your meetings today?
Yeah, I think I've learned a lot, actually. I think even working in a hospital, the patient education specialist role is still a very consulting type role where you're meeting with clinical teams, understanding their problems and architecting a solution or a resource to solve that problem. And I kind of further developed those skills when I started health education design. It was really trial by fire. But I think the lesson that I really take away is to listen. I think the best consultants spend an immense amount of time asking the right questions. Oftentimes, clinical teams come to you with already a decided solution. It's like, I want this. But you have to take a bit of time to understand, so what problem are we trying to solve? And, why do you think that is a problem? And why do you think that education is a solution to that problem? And you kind of slowly tease the story out, and through better understanding of their story, and then later taking some time to understand the patient's point of view in that story and those problems as well, you can take both sides and architect a really great solution that takes both needs into account. And so that's been my philosophy even now when I talk to clinical team members, or even when I talk to my own team members. I actually spend a lot more time listening than I do talking, to understand people's ideas, motivations, and preferences before I provide a recommendation. And that's kind of like my philosophy now. That's how I communicate.
Josh, I didn't know if you had a question.
It's just a moment of heavy breathing.
I'm just looking at the clock. I know we're I think about 52 minutes in. So I think Alan and I have always been trying to make sure we keep things at least within the hour. I know that, Alan, we were planning to try the Fast 5 lightning round question set for the very first time, but I want to make sure we didn't miss any other key topics, Alan, that you wanted to cover.
Not that I know of, but Denice, I mean, if you have anything else that you want to mention about the space, health literacy, accessibility, anything there. Otherwise, I mean, Josh is right. We do have 5 kind of rapid questions that we wanted to fire at you, but if there's anything else first.
I mean, I could talk for hours about this stuff, so that's probably the wrong question to ask me.
4-hour conversation.
Yeah.
I just remembered. So.
So
I mean, go ahead. You can do the rapid fire question.
Okay, great. And Denice, we'd love to have you on, because I know for sure you could talk for another 20 hours on this subject, and there's a lot more that you could get into, the nuances of things and health literacy. But for the Fast 5 questions that we had, to start, do you have a favorite book or book that you've gifted the most to people?
Well, I think I'm a Christian, so my favorite book would be the Bible. A cliche answer, but yes, very true.
Excellent. What about a person who is either dead or alive that you would like to meet most?
Yeah, I actually love reading about animal behavior. And one of my favorite authors is Dr. Temple Grandin. She is an animal behaviorist and researcher who also has Asperger's, which has gifted her with a special ability to really understand the animal's point of view. So I would love to have lunch with her and just like pick her brain and ask her about her experience and understand more about animals through her lens.
Denice, can I ask you a twist on that question? This is actually not on the list, but it just came to mind. So let's throw a COVID-19 spin on that question. So who is a person, dead or alive, who, if you're stuck, shelter in place for months during COVID-19, that you'd have to be with day in and day out, who would that person be? And yes, like your family, friends, etc. But assuming you can't
My
be someone
husband.
Good answer. But who in history would you say, hey, all right, let's quarantine together?
Oh, that's a really good question. I guess someone who would be an amazing conversationalist. Who would be really fun to hang out with?
You're saying Josh or myself?
Yes. Yes, it's definitely one of you.
But only one of us. One of us is not
definitely
a
one.
good
I think one author that I like to read his books of, I think his name is Malcolm Gladwell. He wrote a lot of very interesting books about human phenomenons. And I think if I was really stuck in a room with someone and I needed to, learn more about the human experience and get some good stories in, I think he would be a pretty good candidate to talk to for 24 hours.
Oh,
Well,
definitely.
Malcolm Gladwell would probably say that you have to commit to at least 10,000
I
hours.
know,
Right.
exactly. I'm thinking that too.
I have another COVID-19 related question, Denise.
Okay.
Since the pandemic started, have you taken up any new hobbies or activities?
Um, Hobbies or activities. Aside from doing a lot of COVID-19 work,
Right.
24 hours a day, that's taken up a lot of my time. But recently I have been biking more, kind of retaking up that hobby now. So, I mean, just the other week we went on a super epic bike ride with my sister and my husband and her fiance, and in a conservation area, she actually had a major wipeout and
Oh,
broke her hand.
oh my God.
So maybe we're biking a little bit too much and a little bit too epically. But that's definitely my new hobby. I try to go every few days recently, and go to experience some nature, get some fresh air. But yeah, I guess that's my latest hobby.
And I know another hobby just from knowing you at work and outside of work, but you're big into plants. Like you, all the at
Mhm.
SeamlessMD at the office, we have a ton of plants, and Denise is the plant mom to all of them. And you make sure that the office is just filled with greenery all the time, and at your house as well.
Yeah, I mean, I am definitely the crazy plant lady of the office. I think because I grew up in Markham, like in the middle of, at that point, it was the middle of nowhere. There was a lot of trees and deer and foxes and all sorts of interesting thing. I'm very used to being around nature. So after moving downtown, I actually created my own little garden paradise, basically wherever I went. One in the office, one at home. So I grow a lot of plants. So I have a ton of herbs that I grow. I make my own pesto at home. I have like mint for mojitos. I grow my own figs. I have pomegranates, lemons, tomatoes, green onions, all sorts of very interesting things. I call it my little Garden of Eden. But yeah, it's kind of the way that I relax when I get home. And also the bonus is you get a really great snack.
Totally. Maybe to cap it off, Denise, do you have a good like health literacy story?
Yes, I do have a good health literacy story. So it was a number of years ago, and it was Christmas Eve, and I was still working at the hospital at the time. And I had just packed up, and we were getting ready. I was getting ready to go, excited to start the festivities at home. So I hopped into one of the side elevators and one of the more quiet elevators in the hospital. And I just kind of hopped in, and I noticed that an older woman actually stepped in beside me, and she kind of just stood in front of the buttons. After a few moments, I actually noticed that she didn't press the buttons. So I turned over to look at her to see if I could offer her some help. Um, and it was then that I realized that there were tears streaming down her face. And I turned to her and I said, "Hey, is there anything?" My heart broke at that moment. And it was Christmas Eve. And I turned over and I said, "No, is there anything that I can help you with?" And I said, "Where are you heading?" And she said, "Oh, my husband actually just came in from the emerge, and I'm supposed to make my way over to admitting to register for him. But I am just so tired and so overwhelmed that I don't know what button to press, and I just can't do it." Um, and so I said, "Oh, don't worry about this. I'm heading that way." I said, let me walk you over there." I wasn't heading that way, but I really wanted to help her. So I pressed the button, and we slowly started making our way over to admitting. And as we were walking there, I think she was just kind of trying to ease the mood a little bit. She was asking me questions, like, "What kind of work do you do?" I told her about patient education. And she's just like, "Oh, how long have you been doing this? Do you find this work meaningful?" And all that kind of stuff. So we just kind of made small talk. on the way to admitting. And when we got to the front of admitting, she actually stopped there and she said, "Thank you so much, for taking the time to bring me here." She actually grabbed my hands at that time. This is pre-COVID. So she grabbed my hands at that time. And she said, with tears in her eyes, she said, she's like, "I am a nursing professor."
Oh, wow.
And she said, "I have been teaching people how to help people in healthcare for, all my career, all these years. I'm not going to lie. I am ashamed and embarrassed that, in this moment when I am on the other side, that, when I'm tired, when I'm exhausted, I'm not able to focus and process the simplest things." And, we talk a lot about in healthcare, the effects of pain and stress on a person's cognitive abilities. But, this is the truth. Healthcare is really when you're on the other side is a great equalizer, and really is, the reason why we spend so much time doing what we do on a day-to-day. It's really not just for the little guy. It's really work that we do for everyone and their parents and their grandparents, for the nursing professors when they come through the healthcare system, so that they feel supported as well in their time of need. And that's kind of, my philosophy, like, keep doing what you do in patient education, and eventually, you'll be able to help everyone going through the healthcare system.
Beautiful.
Yeah.
That's a great story, Dave. Thank you for sharing that. Actually, not to laugh again about the joke you made in the middle of it, but as you were saying that, I was imagining in my head, like the next generation of people, like kids who are born today and grow up in a post-COVID-19 environment. Hopefully post-COVID-19, we'll see, I guess, right? But I can imagine, like, in the future where your people don't shake hands and you're not allowed to just, like, grab someone's hand and
without them jumping backwards. Moment lost.
Then to hear your story, and the kids in the future are going to say, "Oh my gosh, is that legal?"
Did you have masks on? Were you 2 meters apart?
Yeah, exactly. I was thinking when you're telling that story. But that is a beautiful story. Thank you for sharing.
You're very welcome.
Well, Denice, I'm looking at the time, so we should probably end it. But I do want to, thank you so very much for having this discussion with us. It's important for, the millions of viewers that we have to understand health literacy, and especially how digital patient engagement fits in with health literacy, and how health literacy fits in with digital patient engagement. And basically, it's a great indication of where we can go in the future in engaging patients and meeting them where they're at with patient-centered care. And health literacy is obviously super important to do that. So thank you, Denice. Thank you so much for joining today.
Thanks for having me. It was fun.
Thanks so much, Denice.
Okay, bye.
Bye.
See you, everyone.